times get hard, and we're here to help at North Point.
Hello and welcome to another episode of North Point Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by North Point Health and Wellness Center. We want to connect you with topics in health and wellness that impact our community. And we want to provide you with practical tips and resources you can use. Today's episode is about stroke, a health crisis that impacts thousands of Minnesotans every year. The numbers tell an urgent story. Did you know that every 40 seconds someone in the United States has a stroke? For communities of color, including Asian, Black, and American Indian populations, the risk of dying from a stroke is 20 to 55% higher than the state average. We are pleased to have one of our primary care practitioners, Dr. Robin Councilman, in the studio today, sharing her insights about the topic of stroke. Let's dive in. Dr. Councilman, thank you for being here today.
Thanks for asking me.
Yes, we're super excited. So let me just ask you, so you've been with North Point for a while.
Yes.
How many years?
Well, I started with our patients 29 years ago last month.
Wow.
It was when we were at a little clinic called Glenwood Lyndale that then, after about 6 years, got moved into what was then Pilot City and became North Point. So.
Wow, you've been here since the beginning almost.
Yeah.
A long time. And so now you are board certified by the American Board of Medicine Professionals, and you work with many patients from many different cultural backgrounds. And I'm understanding that you are a mom to 2 young adults. You're married to another HCMC family physician?
Yes.
Okay, and in your spare time, you enjoy hiking, biking, and spending a lot of time dog walking and gardening, correct?
Correct.
Wow, and you also cook?
I do.
Yes.
I do.
Okay. All right. Well, we are going to start. We'll jump right into it. Can you explain what a stroke is and why it's such a major health concern?
So a stroke is when the brain stops getting the blood that feeds it. The vast majority of strokes are that there's a blockage in a blood vessel, so kind of the pipes that take your blood. So it's taking your oxygen, it's taking the food to important parts of your brain, and it gets blocked, and all of a sudden there's no more oxygen and no more energy going to that part. So that part of the brain starts to die very quickly. And then there's a less common type of stroke where you get a bleeding in the brain. And, we just talked about blood getting blocked off, so there's nothing that it needs. And you'd think that, well, if it bleeds, then you've got too much of what you need. But the blood in that case is in the wrong place, and it's still not getting where it's supposed to be.
Okay.
So stroke is when you lose blood flow to parts of the brain, and the parts of the brain affected start to die very quickly, but it's not like immediate. That's why stroke's so important, because getting care quickly can make a huge difference.
So what are some of the symptoms of someone having a stroke?
So there's the American Heart Association has it's called BFAST. So BEFAST, as a way to remember. You're thinking, oh my gosh, I think mom might be having a stroke, or my neighbor might be having a stroke. I can't remember what it looks like.
Okay.
B, for balance. Somebody who was walking fine an hour ago and now is off balance and having to hold on to the wall or starting to tip.
Okay.
E is eyes. Again, somebody who was seeing fine yesterday and all of a sudden their vision is very blurry. They can't see, or they're seeing double vision. They can't see right. So F is for face. So again, somebody who was looking fine and all of a sudden their face is drooping. And if you're not sure, you're like, your face looks a little different than usual, ask them to smile. And if half their face goes up when they smile and the other half doesn't, you need to assume that's a stroke until you know otherwise.
Okay.
The A is for arm. And the thing is, it's the same thing if the leg. you can't move it or it's weak. So, you know, you were drinking your coffee and all of a sudden you can't pick up your coffee cup. Or you walk to the bathroom and now your right leg won't move.
Okay.
You have to assume that's a stroke. S is for speech. So you're talking and then you're slurred. You go to bed and you wake up in the morning and you're not speaking right. Either your speech doesn't sound right or you can't find the right words. So what your brain's saying
isn't
and what's coming
processing the
out
words.
is
Okay.
not the same thing.
Okay.
And then the T on Be Fast is time. Time is so important. So if you think any of those suggest a stroke, call 911.
Right.
And it's time to go to the hospital. And I have to say, call 911, don't, well, I'm close to HCMC, I'm gonna put them in the car and take them there.
no.
Because as soon as you call EMS and say, I think mom, grandma, neighbor, myself is having a stroke, they start not just EMS, but they start preparing at the hospital.
Okay. Good
So,
tip. That's a
yes,
good tip.
yes.
Now, I'm trying to remember from my Girl Scouting days. Isn't there something where if you think someone's having a stroke, do you lay them on their side, on their left side or something? Or am I making that up?
That has to do with pregnancy.
Oh, there you go. All right. That's only for pregnant women, not if you're having a stroke. Okay, so disregard. So we talked about for communities of color, that Asian, Black, and American Indian population, that the risk is increased 20
Yes.
to 55%. I don't know if I'm off with those numbers, but it's a higher
very higher.
average. What do you see as the main reasons behind this disparity, Dr. Councilman?
So I think there's two reasons.
Okay.
And I think, and we'll start with the communities affected, though really I kind of feel guilty about saying that. I think that there's not as much knowledge of the importance of getting care right now. That stroke isn't something you can go to bed and sleep it off. I think that's part of it, and the importance of managing the diseases that lead to stroke. The other side is the healthcare system, and we have to be honest, and I am getting old. When I was in medical school, diseases were taught as they look like in a white man.
Yes.
You know, and I surprise my younger colleagues when I say that. But, you know, among women who's having difficulty speaking may not get the urgent treatment that a white man who walked in not being able to move their left arm may get. So I think we have to understand that communities have some responsibility for it, but the healthcare system does too.
As
And we
well.
need to work on both of those.
Sure. You know, that's interesting that you said that, because Commissioner Angela Conley, when she talks about her heart attack that she had, and she talks about the symptoms and how, yes, for African American women, the symptoms looks very different than what we standardly hear,
Correct.
which are symptoms for a
Correct.
white male. So that's
I am old
interesting.
enough that I was taught that women, especially women before 60, did not have heart disease.
Really? Okay. Well, we know that's not true.
Exactly, exactly.
We know that's
and
not
the same
true.
idea with stroke, because Hmong women can have strokes in their 50s. And right, if you were educated as a woman doesn't have vascular disease until they're well into their 60s, you're going to think about a whole lot of other things before you come to that
Sure.
stroke in a 51-year-old Hmong woman having a stroke.
Well, let's talk about the Hmong community, because it's my understanding that you have a great deal of experience working in the Hmong community. You've gained a lot of respect. You're viewed as a trusted messenger, I would say. How long have you been working so closely with our Hmong community, and how did you establish this level of trust?
So 29 years ago last month, I started at what was a little tiny clinic that had been formed by a Hmong and Laotian Elders Association in conjunction with Minneapolis and, at that time, Hennepin Faculty Associates, the physicians group for HCMC. And it was very much focused on, well, it was started with Hmong and Lao, and then we had a sizable Somali population. And the only ones who worked there who were not Hmong or Laotian were the dentists, the doctors, and the RN, which nowadays could be different, but that's how it was
Back
then.
then.
But the co-workers from the community were every bit as responsible as the providers were at making sure we took good care of our patients. And so if I was going off the rails and totally missing something that this patient believed that I didn't understand, it was other people not only had the right, but had the responsibility to say, Dr. Councilman, let's step out and talk. And the fact that they did that was so helpful to me. And then the patients who were willing, I mean, this was not a time with a lot of trust between Hmong patients and Western healthcare providers. So the fact that these patients would at least come in the door and talk to me was such a
That was a big step.
privilege.
Big
And
step,
that they
yeah.
would say, you need to learn this. I used to think of it as chair time. The patient would say, you need to know this. And how much of an honor that that patient was willing to share, you know, what life was like before the war, or what life was like during the war, or what life was like in the refugee camps, or having just come to America. And so I believe I'm the doctor I am today because of my Hmong co-workers and my Hmong patients.
Wonderful.
And I now take care of great-grandchildren all the way up to their great-grand.
Wow. So you've seen those families. They come back.
Oh, yeah, and they
Oh,
bring
my
their family
gosh.
members and their friends,
Wow.
and it's been lovely.
Okay.
It's a career I never
Beautiful.
thought I would have, and boy, am I so grateful for it.
It's wonderful. Well, tell us, I want to go back to just some general information about strokes. So what are some of the leading risk factors? You started talking about that, other health
Yes.
disparities that
So
contribute.
number one by far is high blood pressure. And even a little, what you consider a little bit of high blood pressure over decades and decades weaken those blood vessels and increase the risk of a stroke. So, you know, I talk to patients who, you know, they may be in their 30s and their blood pressure's 145 over 90, and they're like, but I'm close and I don't want to take a medicine every day, and I'm trying to cut down my salt and I'm getting exercise, but I can't quite, but we're close. Isn't that good enough? And the thing is, the younger you are, the more important it is that your blood pressure be where it's supposed to be, under 130, under 85, or under 80, and not put that pressure on your blood vessels over decades and decades.
Okay,
you know?
because it's over time.
Yes.
And
there-
that- okay.
It can be high enough. I tell my patients, you know, that, well, my you know, they'll say, my cousin was 220 over 130. Mine's never like that. I'm like, thank goodness yours is never like that. I hope it stays that way. Because a blood pressure like that can cause a stroke, especially the bleeding type stroke, right now.
Right away.
So we want to treat that right away. But the little bit of high blood pressure over decades also
That adds up.
increases. Yep, and that's probably the most common.
Okay.
Diabetes is the second thing. Diabetes increases the risk of clogging any of your blood vessels, and some of those are the ones to your brain. So again, you know,
Yeah.
we'll let your blood sugars be higher when you're 85 than when you're 45
Sure.
or 25 or 15.
And I'm blessed with both.
Oh.
I know. I know.
Right, but see, this is exactly, you can do everything right. This is, patients think the diagnosis of high blood pressure or diabetes means a failure on their part. And there are things we can do, diet, and there's things we can do, exercise, but a lot of people, it's hereditary.
It is?
My dad had
Yes.
high blood pressure starting in his early 40s, so guess what? I had high blood pressure starting in my early 40s.
And that's when it manifests itself. I was an athlete most of my life, and then I hit my late 30s and 40s, and all of a sudden, here comes the high blood pressure, here comes the diabetes. So,
Right.
yes. Well, let me ask you, going back, are there specific health disparities or barriers that put the Hmong community at higher risk?
So for one is the high blood pressure and the diabetes is so common.
In Hmong community?
Absolutely, and at young ages.
Okay.
I am seeing more and more 20-year-olds, 18-year-olds with diabetes and high blood pressure. And a lot of it, if you ask their moms and their dads, have it.
Yeah.
They don't, they may not have known grandma and grandpas, and certainly maybe not great grandmas and great grandpas, because screening for blood pressure and sugar wasn't a thing that could be done, back in Laos. Part of it is the American diet, but I think part is just a tendency towards these diseases at a very young age.
Wow, 18.
Oh, yeah.
Oh, that's amazing.
And think of dealing with diabetes or high, you're looking at this and you're like, I need you to take a medicine for the rest of your life.
Yeah.
And you're 18 years old.
Yeah, that's hard. That's hard. What about cultural beliefs and traditions? Because you talked about at the beginning of the interview, members from the Hmong community just walking into the door, into the clinic. Are there some beliefs or traditions within the Hmong community that shape understanding of stroke and its symptoms?
So there was a study out of Regent's Hospital just across the river a year and a half, 2 years ago, maybe 3 years ago, where they looked at first stroke of anyone who walked in their door. So they had a huge diversity of population from across the Twin Cities. And Hmong patients had stroke at the youngest age, about 10 years before other people. So I said 50. Really, 50 years old is the age of the first stroke for a lot of Hmong. Okay. And blood pressure was the highest risk factor. And so part of it is, and this is a lot of communities that did not have access to very westernized focused healthcare, where we do a lot of testing. The idea that illness is things that affect your ability to do your normal life. So your gout in your foot where you can't walk is a big deal. Your headaches, your back pain, your problems seeing, your problems hearing. But blood pressure being a little high, blood sugars being a little high, things that do not affect how I feel today.
The silent
diseases are not very well recognized. And there's a lot of fear that, here you're telling me I've got this disease that's making no difference. And even you tell me as my doctor that, we're treating it because of what's going to happen in 10, 20, 30 years. But then you're giving me a medicine that I don't really want to take every day. And, it may have some side effects that I don't want to put up with. And so that's a big community education thing. People knowing that, yes, your high blood pressure may only be a little high and you may not. I totally sympathize. Who wants to take a medicine every day, or 2 medicines or 3 medicines or 5 medicines bought to prevent a stroke? The other thing on that study out of Regions that really worries me, and I see it in my patients, is what a Hmong family tends to do when somebody starts showing symptoms of a stroke. Because, if my husband started showing signs of a stroke, 911 would be called right now. In general, and that's what the study showed, Hmong, let me go lay down for an hour or two and see if it goes away. And I wake up and it's not gone away. Let me call the massage lady and let's see if it gets better with massage. And then if it's still not getting better, let me go have somebody take me to the hospital. And the time is measured in a few hours, and the longer you go with a stroke, the more the brain is damaged. And so the sooner you can get to the hospital, the sooner they can start opening up that blood vessel, the less long-term damage. So not only do Hmong have strokes earlier, they have strokes that are more impact the their
Sure.
lives for more and more
Because they've waited
because they've waited.
to seek care.
Yeah, on average in that study, 24 hours.
Yeah.
You know, and that's a big deal. You can't, that brain has already died.
Sure. Now, I know here at North Point, 41% of our guests receive services in their native language.
Yes.
Talk to me about how important it is for to have bilingual or bicultural health professionals in this work.
So, absolutely. And I kind of feel guilty when you ask that question.
You
Because
do?
you notice I am not Hmong.
Well.
And I am terrible at languages, so when I try to speak Hmong, the interpreters usually look at me and say, "Oh, you didn't want to say that." But I agree with you.
Yes.
People who can understand the culture and the background of the patients and speak to them in their primary language really can provide health care better. I believe that. And we are so lucky at North Point. We have Dr. Zhang, who's a fantastic family doc, and we have Dr. Mei Hong, who's a doctor of nurse practitioner, and they both bring that bicultural, bilingual care to patients that I can't bring. That said, we have amazing interpreters on North Point.
We do.
And
Yep.
they can help us bridge that gap. So even, a patient coming in through our urgent care or through our pool, so they're getting seen because they're sick today. I'll often hear my patients say, "Well, I don't want to come in because you're not there." Well, you know what? Lee Powell will be there, or Zhang will be there, or Von Praka, our interpreters, and they can make sure you get understood and you understand back. So yes, I would agree that ideal is that patients have providers who share their culture and their language. That said, I think at North Point, better than most places, we provide care for patients even when we're crossing those divides.
Sure. Sure.
I figure I've decided I've got 11 years left in practice.
Okay.
All
right.
And one of my goals is to try and get more of my children, the kids I take care
Yeah.
of, to head into the
To the
medical
profession.
field, because
Okay.
I would feel better leaving this work when I know that patients have more access to providers of their own culture and language.
Wow, that sounds like a wonderful, wonderful thing to leave that knowledge. And I wanted to ask you too about the young people, because we have school-based clinics. Are we catching things in our school-based clinics? Are there resources for the young people to educate themselves? Like if I'm a parent in the Hmong community, right, and I know there's some hereditary stuff
Yes.
going on in our family. What am I doing? How can I take care of my child early on to be aware of this?
So I think the school-based clinics are great, but at the same time, when we're looking at long-term chronic diseases that run in families, I actually think we're the whole family. That's why family medicine, whether it's the family practice physicians or our family nurse practitioners, are so valuable, because one of the things I do is review OB outcomes here. And I will look through and I'll see young people saying, "Oh, I don't have a history of diabetes and hypertension." And I'm like, "Yeah, you do." So
Do they not know that?
I think they don't pay attention to it, and they don't think it'll affect their pregnancy. I don't know if they don't know. But one of my things is to try and get, your kids need to know this.
Yeah.
You have high blood pressure at 30. You had a stroke at 51. Who's taking care of you? It's probably your children. I can look at them and say, "Hey, look, you are at risk too."
Yeah.
Moms, we do not want what happened. We're going to work on getting mom better or dad better or grandma better, but we want to prevent it from
Yes.
coming to you.
Yes.
So if you haven't seen a doctor in the last 3 years, you need to for sure men are horrible.
Yeah, men are terrible.
You and I
But our
can
young
say
people,
this.
you're talking to my daughter right now. I tell her all the time, you need to have a primary care physician. You have a family that has a history of heart, high blood pressure, diabetes. You know, you need to be seen because that's so important. I think these 25-year-olds, they think they're invincible.
They do,
right?
And it's worse for men because they don't have babies. But it is so invaluable to have a healthcare provider who knows you and knows your family.
Exactly.
Because if you come in with a change, you may not have noticed it. I tell my patients, you know, you see yourself every day. You don't notice the little changes. If I only see you once a year, or once every 6 months, or once every 3 months, I may look at you and say, how did this change and when? And they didn't notice it.
Right.
Really, I love seeing patients over time, but I also think patients finding a healthcare provider who they can trust and who they can talk honestly to is invaluable for their long-term health.
Sure. Well, we only have a few minutes left, but I did want to ask you, what role do family and community networks play when someone has a stroke?
Oh, so key, because this person's having damage to their brain. You don't make your best decisions when you're having damage to your brain. Not only just the emotional stress of it, but your brain's not working right to make these decisions. Most people find out, they realize they're having a stroke when somebody around them looks at them and say, what's going on? Why is this happening? So whether it's your kids, your grandkids, your neighbor, it's usually somebody else who makes that call to 911, or at least tells you you need to call 911.
Yeah.
You know, the worst thing you can do is see somebody you love and say, oh, I wonder about this, you know, your hand doesn't seem to be moving right. Why don't we see how it's doing in a few hours or tomorrow? What you want to be is the person who says, your hand's not moving right, you know, we need to call 911. You know, if this isn't a stroke, great, we'll be happy and we'll deal with your, you know, it later. But right now we need to call 911.
Absolutely. Well, thank you so much for being on the program today. So much valuable information that you shared.
Thanks for asking me.
Yes, absolutely. Okay. Well, that wraps up today's segment. We want to thank you for listening to North Point Making Health Happen, and we want you to know that we're here to partner with you in creating a healthier community.
And I think we do that quite well.
We do. We do a good job.
I think we do.
All right. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about North Point, call us at 612-543-2500 or visit us on the web at northpointhealth.org.